Hi, my name is Ezra and I'm a medical doctor from the Philippines. I'm a doctoral researcher currently at the University of Lucerne and at the Swiss Paraplegic Research. I have a question for you. Have you ever wondered whether microorganisms such as your bacteria or viruses could be beneficial to your health? Well, advances in microbiology has allowed us to detect far more microorganisms that we can find in our body. And what we found is that it is the balance of their population that is keeping our bodies healthy. Of particular interest to me is in individuals with spinal cord injury, and for the reasons that once they have their injury, they actually have lower defenses in keeping their bodies healthy because of infections. And one of the areas that we are trying to study at the moment is the urinary tract. Previously, we always have thought that the urine is sterile and it's devoid of microorganisms, but advances in studies in the past 5 years have shown that the urine is not sterile. It actually contains microorganisms. And in individuals with spinal cord injury, what we found is that there is dominance of disease-causing bacteria such as your E. coli and your Klebsiella pneumoniae and even your Enterococcus faecalis. So we do believe that this is contributing to the higher risk and higher rates of recurrent urinary tract infections in this population. What we know at the moment is that the diagnosis even of urinary tract infections in individuals with spinal cord injury is delayed because of the injury itself does not allow them to have an early reporting of symptoms, especially that they have low to no sensation in their urinary tract. And what we know now is that they are usually being treated by antibiotics. And when you have repeated use of antibiotics, it also increases your risk of developing antibiotic resistance. And that could prove that you might have more problems eventually in the long run. So what we do in the laboratory at the moment is really investigate what is the optimal microbial community in the urinary tract of individuals with spinal cord injury. Because what we believe is that the balance is really quite important and we need to find out what it is so that we can develop interventions that actually maintain this the population of those who are keeping the urinary tract healthy.